but this is our Rooted in Health live stream. And today's topic, of course, is on the thyroid and also on sex hormones. Stop the hormone madness, fixing the why. So there's lots of individuals who have a lot of fatigue. They may have weight gain or constipation issues or dry skin, a whole myriad of symptoms. And this is the way the conversation usually goes. This is the way the conversation goes. They go into their provider and they say, hey, I've got all these symptoms. And so then they have some testing done, right? So you have symptoms, you have some testing done. And so after you have the testing done, the testing comes back and the provider says, see, here's the problem. This particular lab test we did found the problem. Now we're going to give you the medication. And we want you to come back in 2 months and see if the medication worked. So then the patient, they take the medication, they go home, they take their medication, they come back and they have some lab work done. And the lab work comes back and the lab work may look clinically normal. And so then the provider, you know what the provider does then? He says, see, we fixed it. You're fine. We fixed it. Unfortunately, this is where the problem starts. This is when it starts. They went in, they had symptoms, they got a medication. They then got the testing done, redid the testing, and they still have symptoms. They're still tired and wore out. They still have fatigue. The numbers might look improved on the clinical ranges, but they still have problems. And the reason why is because they did not address the why. They did not address the why. It's important to address the why. If all you do, this is all you do, if you just take the medication, whether it's for hypertension or whether it's for a thyroid condition or for any other condition, you just take the medication. Hey, I'm not going to bash anybody for dealing with a crisis. But if you don't deal with the why, you're fighting a losing battle because you're going to continue to have problems. It may actually continue to get progressively worse, or it will have diminishing returns. And then also the side effects of the medications, you might have to increase your medication and then have increasing side effects from that. So we want to address the why, don't we? Doesn't that make sense?